All right, it is 5 o'clock on a Saturday. It's the time we come together every single day to get an update on how we are not only dealing with, but defeating this worldwide health pandemic, and a chance for all of us to come together to know that we are not alone, and to remind each other that we are going to get through this, and we are going to get through this together. So say it with me. We are going to get through this. We're going to get through this together. One last time. We're going to get through this. We're going to get through this together. None of us are alone in this endeavor. It is the only challenge that I can ever remember where everyone matters and everyone is a part of Team Kentucky. We need each and everyone's best every single day. And I know that's hard because we get tired. Today, I'm tired, just like I know so many of you all are. But every day, we've got to bring it. We've got to realize that our decisions matter. Until we defeat this virus, we have to be strong, and we have to be patient. We have to be resilient because we must win. And every decision we make, lives are on the line. But you have risen to the occasion. We are flattening this curve. Right now, we are doing better against a worldwide health pandemic than we have ever seen. And so let's make sure that we continue that. We want history to ultimately write that we did what it took to help one another. So we're going to get through this because of the 10 rules that we know that we have to follow to make sure that we defeat COVID-19. That starts with being healthy at home. It is the number one rule for a very important reason. By cutting our contacts, by being at home unless we're going to work, unless we are getting supplies, or unless we are getting exercise, is how we engage in social distancing and make sure that we do not spread this virus. And it's why we have plateaued, and it's why I hope in the near future we will start seeing that decline and that 14-day decline that will speed up how we are able to reopen. Remember, avoid crowds and gatherings. Just because it gets nice outside, just because we see the light at the end of the tunnel, just because we may be moving closer and closer to it, and we are. I promise you, we are. Doesn't mean that we can engage in crowds and gatherings yet. Remember, every time we do something like that, we set ourselves back. Days, we could set ourselves back weeks. So by following this guidance, we get to get out of this sooner, and we do it better. Practice social distancing. Make sure 6 feet apart, though that is not an excuse to get together and stay 6 feet apart. Know when to seek care. Our website, kycovid19.ky.gov, is incredibly important, especially as we start reopening with the first reopening in healthcare and in parts of that healthcare economy starting on Monday. The guidance is going to be there. So for instance, dentists aren't going to be ready to be open on Monday because there isn't agreed upon guidance that has to get through given how it can spread through those offices. That is a part of the healthcare that we want to get open and want to get open very soon, but we have to make sure that we are doing it right given how those oral secretions happen in a dentist's office. Wash your hands. Make sure you clean surfaces. Apply for benefits. And let me say tonight, I've talked with our unemployment insurance group, and I've told them that I want to see everybody who applied in March that hasn't been helped this week. That ought to be our goal. If you applied in March, you ought to hear from somebody this next week, and we ought to get your claim resolved. You've waited far too long if you applied in March, and it's not right. Now, listen, this is my administration. It's on me, but it's not right. And I've told our folks that we absolutely have to address that piece this very week, and they have some confidence that they can get that done. Prioritize your mental health. It's not easy what we're going through. It's hard every day, and it's challenging how long we've been at it and where we still have to go. So make sure you're staying healthy. Don't travel and report non-compliance. All right, so we always talk about the 10 rules plus one. Fill out your census. We went up a place. We are 15th in the country, and we are really close to being 14th. But I know in Kentucky we've never said, yay, we're 15th. We want to do better and we want to be better. And there are large amounts of dollars, thousands of dollars, that come to us from basically everybody who fills out this census. When we talk about reopening and rebuilding, a lot of how we're going to do that is based on how many people fill out this census. So please do it. It's going to help us. It, again, is part of our duty as Kentuckians and as Americans. We also ask that every day, following this guidance, doing your duty as a member of the Commonwealth and as a patriotic American, we want you to model it. Make sure that you get it out there on social media so other people see it and that they want to participate in it. So here's a little bit of what we've got today. All right, so this is a 93rd birthday. We talk about the sacrifices that people are making so that we save lives. This is another one of those milestones that everybody would want to be at. But they know in this 93rd birthday that everybody is healthier, doing it in a different way. And again, we're adjusting. We're doing it in a way where people can still interact, but not be physically close to each other so that we don't spread this virus. Let's look at the next. All right, these are our heroes. This is why we have to stay healthy at home. Every time you engage in a mass gathering, you put these heroes at risk. They're going in every day to take care of people who have COVID-19, that have been infected, that might be fighting for their lives, but they're willing to do it. And all they ask for us is to stay healthy at home. Surely they deserve at least that much. All right, this is UK athletics. Again, making sure that they are living that example and that model, that staying home is healthy and it protects everyone around us. Oh, and we just see these types of acts of kindness all across Kentucky every day. In this time of anxiety, in this time of even impatience, it means we need to be kinder and better to each other, better neighbors than ever before. Because that person you may be running past as you're out getting exercise, they're worried and they are anxious. Now, the people that you call and talk to are worried and they're anxious. And every little thing that we do, every bit of chalk art, everything like this, that helps us all get by. I guarantee you something like this gives people additional reserve and strength for days. Just taking a little bit of time can help somebody else get through what they're going through. All right, and this is making sure that we are still serving so many people that need our help, and making sure that we're staying connected in each and every one of our communities. All right, so this is the Bluegrass Music Hall of Fame in Owensboro, and they are lit up green, just like almost every major institution and facility is across Kentucky. We might have some out there that are anxious, but we are more united than I believe that we have ever been. And part of why we're united is that we care about each other, and we are mourning for those that we have lost. Every one of these green lights, which we see more every day, shows our compassion, that we are thinking about everybody out there fighting COVID-19, and also we are thinking about everybody that has lost someone to COVID-19. So let's make sure that we put out more green lights every day, that we ring our bells at 10 a.m. so that people know that they are not alone. And even though in their grief they might not be able to be with others like they normally would, that we are all there for them. This is one of those 10 a.m. bells in Paintsville. All across Kentucky, we are seeing some of the kindest, most unified acts that I have certainly ever seen. This is the type of people we are. One of the reasons that we're flattening this curve in Kentucky is that we are good people, and we are showing it. As your governor, I'm incredibly proud, not just of our actions during this, but the reasons for your actions. And I hope we come out of this as better people based on what we have had to go through. All right, so every day we also take a little bit of time to make sure we're learning to include everybody by learning just a little bit of sign language. And we've learned that there are a lot of kids out there that have become very interested thanks to all our great folks that help teach us every day. So today we wanted to teach them some of their favorite words. So today we're learning mom, and dad. And dad. Okay, mom and dad. One more time. Mom and dad. So to all the moms and dads, now when your kids are just yelling your name, there's also another way that they can express themselves. All right, so we talk about not just our 10 rules, but also our benchmarks on reopening. And I want to go through those and give some updates on where we are. But let me start by saying our goal here has to be to do this right. And we should all want to do it right. We should all want to do it right because our decisions that we make and when we make them are the difference between life and death. But they are also important decisions based on the timing for our economy itself. You know, if we don't do this right and we have a second spike, we end up with more economic damage, and all of our national economists are talking about this, than we do if we simply hurry up and then try to adjust. So I'll admit, there are no perfect decisions, and we are all doing the best that we can. But our goal is to follow the data, is to listen to public health, our commissioner and others, and to do this the right way. And I believe that we are doing it the right way by on Monday starting with areas of our healthcare industry. When we think about a proof of concept of can we, where we are in this pandemic, start to reopen, where better than opening in an area that is used to dealing with viruses and with contagion, and making sure that we see how they're doing it, that the PPE is there, and that it can be done the right way, and that it doesn't look the same as it did before. Until we get a vaccine, our world is going to be very different. In other words, you should never be sitting in a doctor's waiting room. You should be in your car. And everything that we're doing is going to have to be a little bit different up until then. So let's start with our benchmarks. Number one, and this comes straight from the White House, is the number and the rate of new cases. There is no disagreement amongst public health officials or even officials about what we need to see to reopen certain areas in a safe manner. And I saw an opinion piece on TV saying that this required us to just have lower numbers every day for 14 days. No, we just have to have a declining rate for 14 days. Now, that doesn't look like a straight drop. One day we may have a little more, and one day we have a lot less, and one day, but again, we have to make sure where we are on this curve. So if we look at Philadelphia versus St. Louis, if we can go to that, I want to tell you why this is important. What we don't want to do, if you look at Philadelphia, is reopen at the height of the pandemic. I mean, you wouldn't want, if you were at the top of that curve, to reopen because that's when it is more dangerous. Now, Kentucky, you've prevented this. This is not our experience. So let's look at St. Louis, which is next. All right, so you see in St. Louis, a lot like what we have done, they flattened the curve. They took the strong actions that we have. Their people bought into it. And now I think we've done a little bit better in that I don't think we have the curve up. I think we're about flat. Go back, if you will. Right there. But folks, where we are because we are flat is somewhere again right there. And that is good news. That is very good news. But where we have to be to safely reopen is on the decline. Let's show Louisville now. What you see in St. Louis is they made the wrong decision after making the initial right decision, right? They made decisions about how to reopen in a way that led to that second spike. What we've got to make sure is that we know, and the White House agrees, that we are on the decline in a way to where we prevent it. In other words, that we are more of right here on the red line. So that's why it's so important in looking at the rate of cases and where we are. Because, again, if you look at Louisville and their long-term impacts on here, that's how you keep your economy open. You open and you're able to stay open instead of you rush certain decisions and then you have to pull them all back. And that's the way this virus works. And I know we're anxious, but let's admit that the virus sets the timing. It does. And while I think we are plateaued, while I hope that we will find out that we are on the decline, we just have to make sure we make these decisions right. It is in both our health and safety interest, but also in our economic interest. And let's remember, we have and are taking our first step in just 2 days. It's all going to be measured. It's all going to be gradual. And the first things we're starting are going to give us a good look at what we're looking at and help us all be healthier with some of the other services that we need in that healthcare industry. Let's go back to our benchmarks. And let's look at our second one, increased testing capacity and contact tracing. So we're working on the contact tracing piece. We'll have a big announcement soon. But let's look at testing. We have, starting this Monday, more drive-through testing locations by a factor of 2 or 3 than we have had in any week here in Kentucky. We have 11 separate areas where people can get the drive-through testing. And as they come up, they are certainly Louisville, Lexington, Bowling Green, Owensboro. They're in Murray. They're in Rockcastle County. They're in Trigg County. They're in Hazard. We talked about Mount Vernon. So all over the state, and we believe we're going to be able to add to this. This is the direction we need to be going. This is a big increase in our testing capacity and availability. And in fact, since we have opened up our Kroger sites to anyone and everyone who wants a test, we have seen very significant demand. Because of that, Louisville and Lexington, we are doing Monday through Friday, and we're going to do them for 2 weeks, but you can't sign up for the second week until this Wednesday at 5. That's the way their portal works, and we'll talk about that again. So all that's booked in Louisville and Lexington right now are that first week starting Monday through Friday, and we'll talk about Wednesday when we open that up again. I got an email from the county judge executive in Bowling Green today. They are already fully booked Tuesday through Thursday, and they're seeing a significant number of cases, and we want to be there for them. So Judge Buchanan, I'm able to tell you and the people of Bowling Green and the surrounding community tonight that this week we're now going to be open on Friday too. We're going to add an extra day, which will add 300 plus tests, and we're going to stay a second week for you. Again, that's going to mean that people can't sign up until this next Wednesday, but we appreciate you reaching out, sharing your concern. We're going to work with you, and we're going to provide more tests in your area. Let's go back to the benchmarks, and on our website, you can see how to sign up for all of these. Remember that the Kroger sites, you got to go through their portal. The Walgreens and the Walmart, you got to go through theirs. And other areas, you have to call. And I know that's a little bit complicated, but it's because we have great partners out there that are helping us to get where we need to go. I hope at some point we can pull it all together. But right now, if I've got somebody who has testing ready to go and a sign up for it, we're going to do it because I know our people can follow the sites and the ways to sign up. All right, our next guideline. is personal protective equipment availability. And I showed you what we had in the state, and we continue to do better, though we are now sending it out, especially to nursing homes and other facilities. But this is really important in our hospitals, making sure that they have stockpiled enough to deal if we get a surge or a second wave. It's also going to be important for our businesses. So I saw a question the other day that said something like, if PPE is hard to get and I can't get it, can I still open my business? Well, the answer is no. We can't be doing that. That would spread the virus. I mean, if you don't have the PPE and we're going to work on its availability to protect your employees and your customers, then no, we can't do it in a way that would spread the virus. And I hope nobody out there would want to. And every group that I have talked to uniformly has said, we want to do this safe. Let me thank the Chamber. As some of you all know, we haven't always agreed on everything, but they have been really helpful and really supportive during this crisis. They are working on some of these issues, and their commitment the entire time, being the voice of the business community, is we want to do it right. We want to do it in a way that is best for our long-term economy, and we want to do it safely. And that was a group that was out trying to find PPE and get donations at a time when it was incredibly difficult. And talk about unifying during this. Sometimes people talk about business and labor. At the same time, labor, our plumbers and pipe fitters down in Western Kentucky and Paducah were driving around picking up N95 masks and donating them. This was an everybody together. All right, the ability to protect at-risk populations. So we're working on this right now, and this is the challenge. So remember, our decisions that we make, if they significantly increase contacts, and they get into one of these senior living facilities, we've seen what they can do. We are now engaged in a major testing initiative at these facilities, working with them directly. There are now more resources available than ever before. But let's face the reality that this virus is, if it gets into some of these facilities, no matter what we do, it's going to have devastating consequences. So we just have to be careful in how we do this, making the right decisions at the right time, because it's the difference between life and death. I believe we can do it, but it's going to take patience and planning. All right, this is the ability to social distance and follow CDC guidelines. This is what our Healthy at Work initiative is all about. In receiving the various proposals, we're getting some from individual businesses, some from industry groups, but what it does is it helps us put together mandates for different industries to meet to make sure that folks are safe when they go back to work. What this means is that there's input, and there's input from really three areas, and I'm sure it's more. It's the business community. It's our local leaders. I had a couple of plans sent by mayors that we appreciate. They were thoughtful, and they've definitely gone in to our thinking. And also our public health officials being critically important in looking at it and ultimately signing off. Preparedness for future spike. Again, if we don't stop this from happening, the impact in lives and in the economy is really hard. So we gotta get it right. Then last, this will be the game changer. We see different news out there all the time. We're gonna have a new normal until we get a vaccine or a very successful treatment. That's going to come, folks. Like, we're all looking for a light at the end of the tunnel just when we can start opening up our economy, but there's a light at the end of the tunnel here too. It might be further away, but have hope. Have hope that we will eventually be able to get back to something more like the old normal, and people are working on it hard. We just got to be strong until that period, and once it comes, we are going to appreciate so many things so much more. All right. And the last thing that I'd say is we got to be flexible. We got to be fluid because the virus is what sets the timetable and what we have to react to. So again, before we get to today's numbers, I want to mention again, unemployment. This is a tough time for everybody. And the number of claims has been greater than ever in our history, but If you signed up in March and you haven't been helped, that is absolutely unacceptable. So we're going to be working really hard this week trying to resolve all of those. You're going to see some new resources coming out on Monday. I hope I can talk about them tomorrow. They're working on parts of the computer system where we hope that we can do a very significant amount for people all at the same time. But I get it. You are 100% right. And this week, I want to see very significant progress because you deserve it. And we'll give you updates throughout the week about how that's going. My hope is it is early in the week. All right, so today, while we have new cases and while we have new deaths, which is hard to say that something can be a good day, it's not a good day, we have a better day than yesterday. And it's a better day even though some of the labs don't report on Saturdays. Even with that included in, these are better numbers. And what that means is we still think we are plateaued, or we're somewhere in the very top part of that curve, which means it's a dangerous time, but we could be potentially starting our decline. We've just got to see a couple days worth of data, 4 or 5, because right now we've had our highest level, and then today, we've got 150 less cases than we did yesterday. So our total number of new cases today is 171. Once we remove duplicates, people from out of state, or cases that don't meet the criteria, our total number of Kentucky cases is 3,905. So we're getting very close to 4,000, but the number of cases, listen, we expected this to be highly contagious, and we are testing more and more, and we're also testing more vulnerable populations where we see it really spreading. And we're doing some analysis on that too, on the most vulnerable population. And my goal is to get to a place where we can even have our testing in buckets. We have that for our most vulnerable, which are those in nursing homes, those in our prisons, also our first responders and our healthcare workers who are exposed to this virus, making sure that we have a stable, ready group of testing for them. Then we got our general public, which is a lot of what we're doing in these drive-through sites. And then we're going to have an area for our employers too, because if you're going to do temperature checks and somebody spiked a fever, you got to send them to get tested almost right away so we can do that contact tracing. So our goal is to build out that infrastructure in a way to where we can get back to doing a lot of things, even though the world looks a lot different. So 171 new cases today. By county, 33 in Jefferson, 20 in Graves, 19 in Warren. Again, a good reason why we're adding an extra day this week, and we're going to stay next week as well. 9 in Fayette, 5 in Boone, Butler, Grayson, Hopkins, and Muhlenberg. 4 in Barron, Kenton, and Ohio counties. 3 in Adair, Bullitt, Callaway, Campbell, Marshall, McCracken, Perry, and Webster. 2 in Boyd, Davis, Edmondson, Hardin, Meade, and Pulaski, and 1 in Allen, Bath, Garrett, Greenup, Henderson, Henry, Jessamine, Laurel, Madison, Marion, McLean, Simpson, Spencer, Taylor, Trigg, Washington, and 1 is unconfirmed. Total number of tests, 46,558, and those are tests that have been processed by the labs. We're going to have a lot of tests as we move into early next week based on what we did last week with the 48-hour turnaround. Our testing capacity is significantly increasing. We need to do a lot more, but from where we were to where we are right now, we are moving in the right direction on testing. And the better that we do, the closer that we get to taking lots more steps. Number of Kentuckians ever hospitalized, 1,266. Currently, 301. Ever in the ICU, 605. Currently, 164. I think that's about the exact same number as yesterday. We're glad that didn't increase, but think about those folks that are in the ICU fighting. And finally, our number recovered. We're now over 1,500. 1,501. Every single one of those is important and helps us know that there is a world beyond COVID-19. Now we do today have 5 new deaths. While that's lower than a number of other days, and we're glad that we've seen it decrease at least the last 3 days. Again, these are 5 folks whose families are grieving and whose communities are as well. I believe all 5 of these individuals were in senior living types of settings, which again shows that our decisions, just because you might not be in one, the way our contacts can increase, we've got to make sure that this does not spread into more facilities and that we respond the right way. The way it breaks down is a 79-year-old female in Adair, an 88-year-old female in Jefferson, a 93-year-old female in Jefferson, 92-year-old female in Graves, and an 87-year-old female in Jefferson. Ethnicity and race of total cases, the racial breakdown is 75.88% white, 13.24% black or African American, about 6% Asian, about 5% multiracial. Ethnicity, 92% non-Hispanic and 8% Hispanic. Deaths of the group that we know, which is about 85% of total cases, 80% white, 17.14% black or African American, 1.71% Asian, and about 1% multiracial. And then of ethnicity, it's really close to 99% non-Hispanic and 1% Hispanic. Very quickly, let's go through a couple of the areas that we have been highlighting. Green River Correctional Complex. We just have one new case today, and that is of a staff member, but we don't have any new inmates today, and that is a very good thing to report. Long-term care facilities. So this is our big challenge. It's grown 24 new residents since yesterday, and yesterday it grew a lot too. We have 5 new staff that have tested positive, and we have 4 new deaths, all of which are residents. So to date, I believe we have lost 94 residents of senior living facilities. Just shows how important what we're doing is and how important the decisions that you make are. These are people's parents and grandparents, and they would still be with us but for COVID-19. I know some people have tried to claim otherwise. No. There might be comortalities, but they're all in the vulnerable population. And this is why we have done what we have done, and it's why we have to continue to make really good decisions. All right, so we've got time for some questions. We have 2 reporters that have agreed to be here on a Saturday. We have Shelby Lofton from WKYT, Philip Bailey from the Courier-Journal, and I've just got a couple of written questions. So, Shelby, you want to kick us off?
You mentioned dentists reopening on Monday, and the Kentucky Dental Association and the Board of Dentistry are meeting this weekend to talk about reopening guidelines.
Right.
Have they been in communication with you? What would that look like?
So it's about dentists, and before a dentist's office can reopen, we need agreed upon rules, and we call them guidelines, but you got to meet them. And a dentist's office is, we got to get it right. And I know every dentist and every dental hygienist wants to get it right because how this disease spreads is through spit and spittle and everything that is what happens in a dentist's office. So there's some additional considerations there just to make sure it's safe. We think that the guidelines will come together fairly quickly, but we want to make sure that all the employees and everybody who comes in is safe. And I will tell people out there, until we get this right, it won't be safe to go. Now, once we get it right, we believe that while there is some risk, we'll have mitigated that risk. But we just want to make sure that we're working with your dentist and their dental hygienists and getting it in the right place. What should people do if they're called back to work but do not have child care because child care is closed? When we look at the president's plan of reopening, when you hit phase 1, The White House is recommending that we do not restart childcare because of the way that contacts spread. That's going to be a major challenge, so let's start planning for it now. But if we're going to be able to reopen, that's a step we can't take because the experts say that those additional contacts spread the virus, especially through asymptomatic means. Phil.
Governor, let me ask, as far as who can authorize or conduct COVID-19 tests, can doctors do that, can nurses, and will pharmacists ever be allowed to do so?
So the question is, who can conduct COVID-19 tests? It is doctors, it is nurses, it is now pharmacists. My goal is anybody that has general training. Think pharmacists, give vaccines. And so as long as we've done the training and we want effective tests, right? We want to make sure that we eliminate any amount of error that we can. I want as many trained folks as possible to be able to administer them. And I will tell you, the folks who are doing this are special. The willingness to stay open in Pikeville until almost 10 p.m. last week served 530-something people. These are heroes on the front lines. With regards to antibody testing in northern Kentucky, when might that start? And we're still looking at the different forms of antibody testing. They are still not widely available in the United States. Some of our universities are doing some pilots in it, but that's part that we're still building up. And then when might we have more drive-through testing in northern Kentucky? So our partnerships are growing. We're also looking at opportunities with hospitals and other groups, but we want to make sure that we're back in northern Kentucky. We had a great partner in Kenton County. We thank their county judge. It worked incredibly well, and we're going to get back there. Shelby?
Churchill Downs and other Kentucky racetracks have submitted protocols for safely racing without spectators. When can we expect the horse racing industry to start back up?
The question is about Churchill and other parts of the horse racing industry submitting protocols and where we are. I actually talked with Churchill right before we started this press conference. We are going back and forth. Obviously, we are at the height somewhere in the plateau, but that'll still be our height of this pandemic. But they have offered some really detailed proposals, and we're trying to figure out the how and the when that it will be safe. And everybody, the racing industry and public health, want to make sure that it's done safely and correctly. Phil?
Governor, these protesters outside, I had a chance to hear some of them chanting and speak with some of them. They assert that Muslims are still allowed to go to mosques while you're tracking Christians' license plates. Can you please address whether or not some religions are allowed to continue to go to places of worship versus others?
Apparently, there's if you can hear the noise outside, Philip Bailey has talked with them and said one of the things that they were saying to him is that Muslims were going to mosques, I guess, for Ramadan, but Christians weren't allowed to go to church. Folks, our orders apply to every single mass gathering. They don't single out religion. It's every mass gathering. Nobody is being singled out whatsoever, and a judge recently ruled that in one of our cases. And to my knowledge, there isn't a single mosque open across Kentucky. Those are fear tactics. Those are ways that people try to divide each other. Listen, we are all Kentuckians right now. COVID-19 can attack and take the life of anybody. And so let's make sure that we're caring about everyone of different faiths and otherwise. And you know what? Some of our Pakistani doctors, and I don't know if you have this slide, actually brought masks, K95 masks, to donate to us the other day. So this is Dr. Bobber, who is on your left. He is one of the leaders in the community. He's an amazing guy. He's pushing for compassionate Kentucky. The person on your right is our Secretary of Health and Family Services, Eric Freelander, though he looks like Hannibal Lecter in this picture. So from now on, instead of me saying you can't be doing that, we're going to have Secretary Freelander call you. All right, we'll take one more question from everybody. Shelby, you have one more?
The Clark County Fiscal Court passed a resolution asking you to allow them to begin the process of reopening, and those in favor said that they haven't had any fatalities in that county, and a lot of the cases, they've been recovered. What are your thoughts?
So the question really comes down to a single county trying to move into a phased reopening. The virus doesn't care about county lines, and this is even a county where people drive over to Fayette County or back and forth or from surrounding counties to work. I appreciate the thought that they put into it, and we're going to listen to it as well as all other leaders, but we have to have a concerted action plan if we are going to save lives and do this safely. If one county did it too early, the virus sprang up, and we're seeing this virus in different parts. I mean, Western Kentucky got hit hard and fast. Bowling Green, we're seeing a lot of cases right now. If a county makes the wrong decision and causes a big outbreak, that sets the entire state back. So our goal is to work together, to listen to one another, and to move forward in a unified front. If there is a time when we can do something regionally, it won't be by county, it'll be by region, and that'll still have to have a lot of thought. All right, last one.
Governor, we were reached out by a reader today who said that she has gotten back into the state, was under quarantine, but she got a negative test result before her quarantine days were up. Is she allowed, I guess, to still do social distancing and everything else as others are, but is she still allowed to go outside of her home and things for that, for essential services?
So this is an individual who came back into the state. We've asked them to quarantine for 14 days, but has gotten a test that says they're negative. I'm going to ask Dr. Stack to answer that tomorrow night because you can have a negative test when you have it, but you haven't become symptomatic yet. But I want him to comment on it because depending on the number of days that individual could be in, it could significantly reduce the likelihood they have it. And we want all this to be reasonable, right? If we get to a point where we have really accurate testing and we can limit those number of days, we don't want to restrict people more than we have to. All right, everybody, thank you for helping us through another week. Remember, the virus sets this timeline, but we can see the light at the end of the tunnel. Because of your work, we have saved countless, I believe thousands of lives already. You have not only flattened the curve, you have plateaued it, which I guess is going to be a new verb that you created based on your work. Let's be resilient. Let's not be the generation that got halfway through beating COVID-19 and then decided it was just too hard. Let's make sure that we continue to do what it takes. We make smart decisions about reopening. We watch it every minute and every day as it's going. We expand testing. Folks, we are moving in the right direction, and I hope you see that. There is hope. There is light, but we got to do it the right way. We have sacrificed too much. We have done too well in this test of humanity to not finish it out in the right way. I'm going to be here with you every single day as we get through this, because we're going to get through it, and we're going to get through it together. So we're going to leave you with, I believe it is Atherton today. I asked folks to be creative about graduations and proms, important moments that just this 1 year is going to lose. And we are seeing an outpouring of support, so keep it up. We want to honor all of these things that protect our kids and recognize their very special moments. See you tomorrow at 5.